So, to start us off, I've been thinking about this, and wouldn't it be wonderful if we all had a time where we did not need to take medications? We didn't have to go to the pharmacy to pick things up. We didn't have to spend our copays on prescriptions. We didn't have to take medications. But having said that as well, what a wonderful time that we're living in where science has actually created medications to help us uh, try to be at our very most optimum health. And so for today's Advantage Lunch and Learn series, we're really excited to be talking about pharmacy benefits and the medications and how to make the most out of them. So my name is Dr. Kevin Iwanchinna. I am a family doctor by training, and I've been with Samaritan. I am currently in my 24th year of being with Samaritan Health Services. The first decade I was practicing as a full-time family physician, and then I was overseeing the primary care clinics within Samaritan, and then after that moved into the health plan arena. And I have been here for the past 10 years, and it's been a great ride so far. I think one of my most exciting opportunities as being Chief Medical Officer of Samaritan Health Plans is to really interact with our members, people like you, to see how we can best serve you and be your Advantage choice plan of choice. So for today, our speakers are Danielle Hunter, Nana Amakufor, and Marika Davies. And I'm going to be doing an introduction, and then we're going to get right on to our lunch and learn. Danielle Hunter is the Implementation Program Manager for Samaritan Health Plans Medicare programs. And Danielle has worked for Samaritan for 8 years, and before coming to Samaritan, she worked as a pharmacy technician while obtaining her bachelor's degree in general science at Oregon State University. Go Beavs, but I have to say go Ducks too because my daughter's a Duck. And just a reminder to put yourself on mute so that we don't get the echo. Thank you. But Danielle has worked in a number of different departments within Samaritan over the years, including pharmacy services and appeals and grievances.
Come on.
And for the last 3 years, she supported the Medicare plans and joined the Medicare programs department when it was formed in 2020. Next, Nana Amakufor is Director of Pharmacy Services, and she joined the Samaritan family almost a year and a half ago. She is a pharmacist by training, very skilled at her job, and she obtained her doctorate degree in pharmacy at the Massachusetts College of Pharmacy and Health Sciences, Worcester, Manchester. She's also board certified in geriatric pharmacy. And then lastly, Marika Davies. She's a pharmacy benefits coordinator, and her role focuses on Medicare Part D. She's been with Samaritan for 4 years. So we're really, really excited to have these 3 guest speakers with us today. Just going to cover a little bit of the quick rules of engagement, those rules of the road as it relates to the virtual seminar today. As you may have seen on the screen, we have started recording this so that we can utilize it later. But also, please use the meeting chat feature later on. You can put questions in there, and the chat is accessed in the toolbar at the very top of the screen. And what you can do is you can type in your questions, make comments in the chat, and if you can't find that again with chat, just look across the very top bar. You're going to see right in the middle of the top bar request control. Don't hit that because that's going to take the control away from the presentation, away from the presenter. But then you're going to see people to the very right, and then most of you will see a chat to the very right of people. That's where you can hit chat and then type in questions, comments as we're going through. If you can't find it the way I just described, also see if you can find chat in the 3 little buttons that might have the word more right under it. And then you can hit those 3 little buttons and you might be able to see chat in there as well. For those calling in today, we'll do our best to unmute you at the end of the presentation so you can ask a question. And we'll hold all of the questions during the presentation. That's because your questions are really, really important to us, and we want to make sure we're going to address them all. During the question and answer portion of the seminar, click on the reactions icon. The reactions one is right to the right of the chat. And you can raise your hand, and then we can unmute you when your name is called. You may also need to click on your microphone so we can hear you as well, but we'll try to watch that. Because some benefit questions might be complex, there may be some questions that just can't be answered today. And if that happens, we're going to include those questions and answers in the follow-up email that you receive, along with those survey questions and the video presentation. We'll also mail the questions and answers with your gift card in case you don't have internet access or miss the email. And most importantly, in this time period of Teams meetings, Zoom, whatever we call it, please bear with us if we have any technical issues that are being experienced. You can expect a survey to be emailed to you within about 2 weeks, and a recording of this presentation will come along with questions and answers that were presented. And we really appreciate your feedback regarding today's presentation. As a thank you for attending, we're also going to be sending you a $15 Safeway gift card that can be used for lunch at the deli counter or groceries, gas, or prescriptions. And for the question and answer component, I'm going to make sure I'm looking at the chat box and then direct those questions to the various department leads. So without further ado, I'm going to turn it over to the next speaker to get on with the presentation. So again, thank you all for attending today.
Yes, thank you, Dr. E. So my name is Danielle Hunter, and I'll be doing the first part of the presentation today. Happy to be back again for my second Lunch and Learn with everybody. So as Dr. E already mentioned, today our focus is pharmacy benefits and the importance of taking your medications. So today we'll talk about the different coverage stages, pharmacy copays and coinsurances, the importance of taking your medications, some resources that are available if you need help, and then we're planning to leave plenty of time at the end for questions and answers. Okay, so different coverage stages. So there are 4 main coverage stages that you could encounter in your coverage with us. The first stage is the deductible stage, and this is where you would pay the full cost of medications until that deductible amount is met. And our Premier plan is the only plan that has a deductible. And in 2022, that deductible amount is $200. And that applies to drugs that fall on tiers 3, 4, and 5. So if you're on our Premier plan and in the deductible stage, you'll pay the full cost of drugs on 3, 4, and 5 until you've paid $200 out of pocket. For drugs that are on tiers 1, 2, or 6, you'll pay the same cost sharing you would as if you're in the initial coverage stage. And we'll look at those amounts a little bit later. So if you have a deductible, once you've met that, you move into the initial coverage stage. And during this stage, you will pay a copay or a coinsurance, and then the plan also makes a payment to the pharmacy for part of the cost of those drugs. And you stay in this stage until what you've paid plus what the plan has paid comes to a total of $4,430. Once you have reached that amount, then you moved into what's called the coverage gap stage, also commonly referred to as the donut hole, hence the picture of the donut in the image here. So during this stage, again, you pay for the cost of your drugs. There is a discount that Medicare offers, so to help with those costs a little bit, and we'll talk about that later. But you stay in this stage until the total of what you've paid for the entire year equals $7,050. So whatever amount you've paid through your deductible stage and your initial coverage stage counts towards this $7,050 total. So once you've hit that number, then you'll enter what's called the catastrophic coverage stage. Excuse me, a mouthful of words. And again, this is you and the plan paying costs. But the difference here is that the plan will pay the majority of the costs during this stage. And you'll stay here until the end of the year. So this always runs on a calendar year from January 1st until December 31st for these stages. Okay, so this slide shows us what the cost sharing is in the initial coverage phase for our Premier and Premier Plan Plus. So hopefully this isn't too much of an eye chart for you. I realize it is a lot of numbers. And I've shown here what the difference is for a 30, 60, or 90-day supply. And I wanted to just point out these highlighted cells here. And that's really just to show you the savings that you get if you were to pick up a 90-day supply of drugs that fall in tiers 1, 2, or 3. So you would pay the same amount to get a 90-day supply as you would a 60-day supply. So that's really, money back in your pocket and a good savings for you. So we do run our formulary on a tier basis. So typically the higher the tier number, the higher the cost for a copay or a coinsurance is going to be. Because generally the medications that are in those tiers tend to be more specialized, a little more expensive. Except for tier 6 here, which is our select care drugs that have a $0 cost. And for any members who are on our special needs plan, this is the cost sharing for this plan. So it works a little bit differently because members who are in this plan receive extra help. So you can see here for something that is a generic or preferred multi-source drug, you would pay $0, $1.35, or $3.95 for a 30-day supply. And which amount you pay depends on what level of assistance that you're receiving. And so a multi-source drug, for those who may not know, is a drug that's manufactured by more than one company or source. And it can be available both as the brand name drug, a generic equivalent, or as a generic alternative. And so this slide is showing the cost for when you've entered that donut hole. So once you've paid that $4,430 out of pocket, you're in that coverage gap or the donut hole. These will be your copays. So I mentioned earlier that CMS or Medicare gives you a discount when you're in this stage. So you only pay 25% for if you're on our Premier plan, regardless, because they give the same discount at this point, whether it's a brand name drug or a generic name drug. And then if you're on our Premier Plan Plus, that plan actually offers some additional coverage while you're in the gap. And so that's why you see this difference here for drugs that fall in tier 6, tier 1, or tier 2, where you actually maintain that same copay amount that you were paying in the initial coverage stage. So tier 1, for example, you pay $3 or 25%, whichever is the smaller amount. And then I highlighted these cells here again to show that even in the coverage gap for this plan, you're going to maintain that savings for picking up a 90-day supply of your drugs. But here it's only if they're in tier 1 or tier 2. And so these are the costs that you will pay, again, until the amount that you've paid for the entire year reaches a total of $7,050. For members on our special needs plan, it works the same where you will get that discount, whether they're brand or generic drugs, so the most you would pay is 25%. However, most members who are in the special needs plan generally won't enter this coverage stage. And then finally, once you're in the catastrophic coverage stage, so once you've paid a total of $7,050 out of pocket, then you move from the donut hole or coverage gap stage into the catastrophic coverage stage. And this shows your amounts there. So you either pay $3.95 or 5% for generic or the multi-source drugs. So those are generally going to fall in tier 6, tier 1, or tier 2. And so a little bit different here, it's 5% or $3.95, whichever amount is larger. And then for brand name drugs, which tend to fall in tier 3, tier 4, tier 5, you would pay 5% or $9.85, whichever amount is larger. And a good way to keep track of where you're at in these stages, you get a pharmacy EOB or statement, and it will show you at what stage that you're in or how much you've paid out of pocket for the year. For our special needs plan members, if you do enter the coverage gap stage or donut hole and then move out of that into catastrophic coverage, you will no longer pay anything out of pocket for your medications while you're in the catastrophic coverage stage. And with that, I will pass it to Marika to talk to us about medication adherence and the importance.
Thank you, Danielle. So medication adherence is important. So it is generally defined as the extent to which patients take medication as prescribed by their doctor. This involves factors such as getting your prescription filled, remembering to take the medication on time, and understanding the directions. And why is this important? So being adherent is going to help you get the most benefit out of your medications. It can reduce the risk of disease complications, and it can also help your provider know if your medications are working properly or if they're not working or you're having side effects so they can evaluate and discuss further care. And could you go to the next slide, Danielle?
Yes.
Thank you. So tips to help with adherence. So know when you need refills. Picking up maintenance medications on the same date. If this is something that you're interested in, some pharmacies are able to synchronize your medications, but you can also call our customer service and ask for us to help synchronize your maintenance medications. From there, our pharmacy team will take over and reach out to the pharmacy about getting your medications synced and filled so that you can pick them all up on the same day, avoiding having to make multiple trips to the pharmacy or having to pick up medications at different times. Another great option is to pick up a 90-day supply of eligible medications. This again means less trips to the pharmacy. If this is something that you are interested in, oftentimes it can be set up at the pharmacy directly, or again, you can call customer service and inquire about this, and our pharmacy services team will help coordinate a 90-day supply for eligible medications. This is also a great time if you are interested in synchronizing your medications. All of this can be done at one time. Have your medications delivered. Another great service about having your medication delivered is that you don't have to leave your home. We have many in-network pharmacies that offer mail delivery. If this is something that you're interested in, we do have our pharmacy directory posted on the website, and you can also call into customer service if you would like helping to find a mail order pharmacy that best fits your needs. Request refill reminders. You can check and see if the pharmacy that you're currently getting your medications has a program. Usually they offer refill reminders or sometimes even automatic refills. Sometimes these are through calls or texts or even emails. Danielle, could you move to our next slide? And then here are some additional resources to help with adherence. So if you have a challenge of forgetfulness, it can be setting an alarm, having a text reminder, downloading reminder apps that will alert you when you need to take your medication, having a medication calendar, or possibly a refrigerator magnet. And sometimes you can even get pouches that are prepackaged that have your medications in them. If transportation is a challenge, again, we have a 90-day supply. We have home delivery, or you can use a transportation benefit for a free ride to pick up your medications. If refilling on time is a challenge, medication synchronization, and you can also set that up to have automatic refills, text and call reminders. If cost is a challenge, you can always look and see if there are generics available, or as Danielle had talked about in previous slides, see if the medications that you are taking qualify for a 90-day supply and fall on the tiers that have the extra benefits for paying 2 copays instead of 3. And then it's always important, if you're having side effects, to make sure that you communicate this with your prescriber or pharmacist. And Danielle, I'm going to hand it back over to you for questions and open discussion.
Great, thank you. So we are at the questions and open discussion part of the presentation. So I'll allow Dr. E to help moderate, and then invite Nana Ama to come on and add any additional information that you want to give everybody, and then also be available to answer questions.
Of course. Thank you, Danielle. Good morning, everybody, or good afternoon. I guess it's 12 now. Where does the time go? There are a couple programs with a Medicare plan that I wanted to make sure that our members were aware of. One of them is you may be getting a call from the health plan to help with synchronizing your medications or getting 90-day fills. This is a call that's initiated from us because we sometimes identify that some of our members may need extra help. If you do require extra help, please give us a call. We're here because of you. We are a partner in your health, and we want to make sure that we can do whatever that we can on our end to help you take your medication as your provider has prescribed it, so you can get the most benefit out of your medications and enjoy your life because you don't have disease complications or not suffering any side effects. And then we also have what we call a comprehensive medication review program. This is a CMS program that qualifies certain members based on criteria that CMS has set. And when or if you do meet those criteria, you'll get a letter from us letting you know that you have met the criteria and give you an opportunity to speak with a pharmacist regarding all of the medications you're taking. So any prescription medications, over-the-counter medications, herbals, vitamins. The point of this interaction with the pharmacist is to make sure that all your medications are working well together and one is not causing a side effect of another that's causing you to take another medication to counteract that side effect. So sometimes that happens as well. And so I wanted to make sure that you were aware of those two opportunities in case you get a call from the plan or on behalf of the plan. Okay, I am ready for any questions, either for myself, for Marika, or for Danny.
So I see that Dinesh in the chat had put in a comment about multivitamins, and what could that do to add for costs in plan? So any thoughts about multivitamins? And then I'm going to be looking at people that had raised their hand as well. So do we currently cover multivitamins in our plan?
They are not covered by the pharmacy benefit, since that is an over-the-counter medication, but they are covered by the new over-the-counter benefit that we introduced this year, using your benefits MasterCard. The caveat to that is because they are considered a dual purpose item, you do have to pay out of pocket for that and submit for reimbursement.
Great, thank you for that, Danielle. CJ Archer, you are up next with a question. And
I didn't actually, this is CG Archer. Is that who you meant? I didn't actually realize I put up a question.
Okay.
But I do have one
Great.
about I'm on the special needs, and the doctor has prescribed a medicine that you won't cover. Who do I need to talk to about? And he's done the pre-auth. There's a specific reason why I need that. So what does a person have to do if they have one that you don't cover?
I can take that question. In terms of, my pleasure. In terms of medications that are not covered or on our formulary, which is our drug list, your provider does need to submit information, whether it's chart notes or documentation, stating why the options that we do cover on our formulary will not work for you. When it comes to the design of the formulary, CMS has very specific requirements in terms of we do need to cover at least one option, sometimes, two, if there are multiple ways to take it for every condition on our formulary. So we do have medications to treat everything that CMS requires us to cover. The difference is because there's so many medications for a specific condition, a plan can only cover so many. So if that specific medication, there is a medical reason why that's appropriate and the ones we have on our formulary are not, then your provider states that in the request to us, and then we look at that and render a decision. So that would be the pathways to submit either a prior authorization, or if you've gone through the initial prior authorization process, then submit an appeal.
Okay, I think they've already done that, and it's not the medication per se. You do cover it in a different format, but the liquid format makes me vomit, so there's no point in me taking it, whereas the pills do stay, but you don't cover the pills.
If you can have that, because this is very specific to you, if you can have a prior authorization submitted again with that information, that extra information, we will go ahead and take a look at it.
Thank you. I appreciate that.
Mm-hmm.
Next, Mr. Ronald Breeze, and thank you very much, Nana Ama, for that great answer.
And I can go ahead and answer that one. So the question was regarding disposal of Sharps containers. When I bought the container at Bi-Mart, they would take it back. Now no one takes them, so what do I do to get rid of the Sharps containers when full? I can take a little bit more look into this, but I do know that our Samaritan pharmacies do take back the containers, but I would like to do some more research and see if there's other available options for our members.
Thank you very much, Rebecca. And now, Mr. Breeze, go ahead.
Yeah, can you hear me?
I can hear you.
Okay, great. Regarding the MasterCard for over-the-counter, I've looked through the list, but I have some things here that I'd like to clarify to see if they're covered by that. The first one is incontinence supplies, either pads or the underwear. Is that covered as an over-the-counter item?
Yes, there is coverage for that, for those items under the benefits card.
Okay. How about Miralax?
I would need to double check and get back to you on that one.
Okay, lactase, glutenese, and AREDS.
Some of those are vitamins, and so let's, Danielle, as you're looking into that, if you can put the specific items in the chat, we can take it back and make sure that we're giving you an answer that is right to the specific drugs that you're asking about.
Oh, here we go. Got it.
Okay.
Okay, yeah, I'll put it in on this and then I'll send it off to you.
That'd be great.
Just to clarify on the multivitamins, I know you said yes, that it was covered, but there was a caveat that we had to pay for it, and then do we have to apply to get approval for repayment? How does that work?
Yeah, so we have reimbursement forms available on our website, or we
Okay.
can also mail you some hard copies. But for any of those items that are considered dual purpose, which does include any vitamins and minerals,
Okay.
unfortunately, the technology behind the card doesn't allow those to work for payment at the register,
I
but
see.
we will reimburse you for those.
Okay. And just to clarify on the incontinence supplies, is that the same type of procedure, or is that automatically paid out of the card
Those should work at the register.
at the register? Okay. Thank you. I'll type in these others and send them off to you. Thanks for your help.
Yeah, you're very welcome. Thank you for the question.
Mhm.
So I'm going to go back to the chat, and then I'm going to go back to the people that have raised their hands. And Carol made a really good comment and question in the chat. So this may be dependent on what Medicare or CMS allows, but she's been trying to keep a backlog of prescription medications for an emergency, which we all should be doing emergency preparedness. Tsunami, earthquake, fire, but she can't get meds until a prescription is due for renewal. So she started to skip days here and there to create an emergency stash. Is there any way around that, still keeping within the confines of Medicare allowables?
Yes, and I can take that, and maybe Marika can supplement after that as well. We do, with the way our medications are set up for any non-controlled medications, you can get a refill when you've used up 75% of the medication. And so that does give you a little bit of buffer where you're not down to the wire before you fill out that medication. And so if you are filling your medications every 75 days, so after 75% of it is gone, whether or not you are on a 30-day supply or a 90-day supply, that should give you enough for, maybe you lost a pill or something spilled. If you lose your entire bottle, or you are going on vacation and need an extra month or so because you will be either out of the country or in a place where you can't fill your prescriptions, we are able to provide lost or vacation supplies for you as well. And so what we want to make sure of is that you're not skipping your medication, so you have a supply available. If, like I said, if you lost your medication and you need an emergency supply, please give us a call and we will work with you in order to make sure that you do have it. And then anytime there is an emergency, like a tsunami or an earthquake or fire or anything like that, we do work with our PBM to make sure that there are overrides in place so people can get extra supplies. So we do account for all of those pieces. So please, by no means, skip any of your medication. Keep taking them as intended, because we do have options in place during these situations to make sure that you keep getting your medications.
Thank you for that. The capital letters MEJ had their hand raised, but they also put in the chat, can you explain more about the transportation to pick up prescriptions? So is there transportation available to pick them up, or is it just delivery for the prescriptions, mail order delivery?
Yeah, I can take that one.
Thank you.
And not on Marika to add anything regarding delivery, but for this year, we do offer a transportation benefit on all of our plans. So if you're on conventional, Premier, or Premier Plus, you have 12 one-way trips per year, or 6 round trips to go to any health-related location. And so that would include the pharmacy. And you can contact Rideline, who's our transportation vendor, for that if you need to set up a ride. And I have a slide at the end here that has some resources, and their number will be there. And I would also add that if you are at a doctor's appointment, or maybe you had to go to urgent care and you need to pick up a prescription afterwards, they'll include that as a stop. If you need to go to the pharmacy on the way back, they'll include that as a stop. That wouldn't count as like an additional ride on your way home.
Thank you.
Thank you for that, Danielle. George has his hand raised and also put in the chat, is the Freestyle Libre glucose monitoring system for type 1 diabetics covered? The reason why we're checking the formulary specifically is there are many glucose monitoring systems in the nation, and we have to specifically ask whether the Freestyle Libre is covered under the pharmacy benefit.
So when looking at the formulary, it does not look like the Freestyle Libre is covered. But if that is something that you are needing, it would be a similar process to what Nana Ama had already talked about, where your prescriber would submit a prior authorization with any relevant chart notes, and then we would review that request and render a decision.
I wanted to add into that for continuous glucose monitoring systems, we do follow criteria that's set by CMS. And so when we get a request for that, we defer to what the CMS criteria state. And that's what's utilized in rendering the decision on that medication. So if it is something that you do need, please have your provider submit a request.
That's a good addition, Nana Ama. It's not us as a health plan that comes up with that specific criteria, but we follow CMS, correct? Great, thank you.
Thank you.
Charlie in the chat asks, some prescriptions are no cost and others have a copay. And I know, Danielle, you talked about those different tiers and benefits, but how is that figured out?
So when we're looking at the individual cost amounts by tier, generally what we're looking at in creating those benefits is kind of industry standard, and we work with actuaries that help us figure out, you know, what amounts we can set those tiers at as well. So we really just try to make ourselves competitive and still at a point, you know, where we're making money and able to remain a plan so that we can take care of everybody. So and I guess I would ask Nana Ama if you want to add anything kind of about how we decide which medications fall into which tier as well.
Yeah, sure. So the other considerations that we do think about is what medications can we put on our preventative tier. We have certain medications for blood pressure, diabetes, generic medications on those preventative tier, because we know that diabetes for example, is an ASCVD risk, so it can predict your risk of a heart attack within the next 10 years. So is not being able to manage your hypertension appropriately. So we look at medications that we can afford to put on a $0 copay so that there are no barriers in place for our members to take them to prevent either complications of that specific disease or not act as a risk factor for another even more serious condition. And we have to pair that obviously with what we can afford to do so without going bankrupt. And so those are some of the things that we consider when we look at what medications make sense to put on a lower tier. For the most part, we're looking at things that treat diseases like high cholesterol, diabetes, hypertension, because those are markers for a future heart attack or stroke or things like that, and want to make sure that there are no barriers when it comes to people being able to afford to take those medications. So that's also a few reasons why we look at what drugs to put on those tiers.
I'm going to have
Thank you very
some.
much.
Oh, this is. Do you want me to bring your lunch to you?
Talk about it after one. Unless it's hot.
Huh?
It's a sandwich.
Thank you very much for that discussion, Nana Ama. Any other questions that may have come up in the chat, or any other people that would like to raise their hand to ask a question? All right. Any other questions about benefits or other questions that may have come up just about overall care? George, go ahead.
Yes, hi, thanks again. One more question. I get weekly allergy shots, and my allergist requires me annually to get EpiPens that expire. And I never use them because so far I haven't had an episode that required it, but to comply with their, I need to get EpiPens, and they're like $400 to $600 out of pocket, and they haven't been covered in the past. Would they be covered in this situation? And how would that, where would they fall in this system?
We do have EpiPen on the formulary for our Advantage plan, and so your provider would need to submit. And Marika, please double check if we have a PA on the EpiPen. We may or may not, but we do cover, it is on our formulary, the generic epinephrine auto-injector solution is covered.
And just to
Okay.
add, there is no prior authorization on the epinephrine solution auto injectors that I am seeing.
Yeah, so it would, if your provider sent a prescription in, it would be covered.
And George, I'm going to ask this question on behalf of what I've heard from you, but is there a difference on the pharmacy benefit side and copay if the prescriber, the physician, is sending in a prescription for EpiPen brand name versus the generic that you just cited? And we'll give our team a few moments to kind of look in the formulary, but I'm just asking the question in case that's a price differential for George. George, you might want to ask your provider to specifically ask for the generic epinephrine.
Because the brand name epinephrine is non-formulary.
I understand. Thank you. I'll check.
Great.
One of you mentioned that vitamins were not covered on that credit card that we get for the at the cash register, but you can call somewhere to get reimbursed. Who do we contact?
Yeah, so we have the reimbursement forms are available on our website, but if you would like a hard copy mailed to you, we can go ahead and do that for you.
Oh, that'd be great. Okay. So do you need my address then, or you have it probably?
I won't have you give that much personal information while we have
Okay.
everybody on the
Right.
call, but I did catch your name is Carol Gard, is that correct?
Right. Yes.
Okay. I can look you up as long as your address is up to date in our system, then I can take care of that for you.
Okay. Yeah. Hard copy would be great. I'm not very good at this computer stuff.
Not a problem at all.
All right. Thank you very much.
You're welcome. Oops.
All right, it looks like somebody may have taken control of the slide presentation, but that's all right. We're still going to ask the questions of all of you if you had any other follow-up questions. And
There
if
is
not,
another question in the chat.
oh, thank you, Nana Ama. So it looks like
I have a question.
is that somebody, Ronald White or guest, or is that MEJ as the guest?
I'm Hazel
Yes.
Wells.
Okay,
MEJ has a question. I typed it in also.
great, thank you, MEJ. And yeah, the MasterCard over-the-counter prescription benefit card is to use quarterly. What if you haven't used it yet? Great question.
Yeah, so each quarter you have $100 to spend. That will always be readily available for you on the first day of that quarter. The amounts do not roll over. So if you haven't used it at all for quarter one, that money just stays where it is. But you do still have $100 available to use for this quarter. If you're on conventional Premier Plus, if you are a special needs plan member, then you have $150 to use each quarter.
So going back to the chat, Carol had also asked, why are both what Samaritan pays plus what she pays going towards getting into the donut hole, but just what I pay to get out of the donut hole? Who might understand the donut hole really well that would like to respond on that?
I mean, I can try. It's really that's set up by CMS, the Centers for Medicare and Medicaid Services. So they dictate how all of those coverage stages work. and what money goes into which amount, how that works within each stage. So unfortunately, not anything that we have a lot of control over as a plan. Really what we can do is try to add some of those extra benefits, like our Premier Plan Plus that has some extra coverage in the gap that we talked about, where you can maintain the same, copays or lesser copays.
Great. Thank you, Danielle. Sandra asks, can you appeal which tier a medication might be on in terms of the formulary tier? Can you appeal that?
So
I can start, and then Markit can add to. In terms of appealing with the cost of the medication, when we're setting up the tiering system, there is a specific price point that determines what tier medication goes on. And CMS has regulations around whether or not a plan can do a tiering exception. And so with a condition, we would need to see what the medication was, but there are certain requirements that the person would need to meet, and not all medications do qualify for a tiering exception. And so if you do have a medication that you do want to request a tiering exception for, you can always submit a request for it. Not knowing the specifics, I can't tell you whether or not it would be approved or even eligible for a tier exception, but you can go through the process and find out if a tiering exception is appropriate for the request that's been submitted.
Great. Thank you, Nana Ama. And Robbie is wondering, are compounded medicines covered under Samaritan Special Needs Plan?
I can go ahead and take that one. So compounded medications can potentially be covered. It's another situation where you would want your provider to submit a prior authorization that included all of the medications that were going to be compounded, and then that would be reviewed by one of our pharmacists and a decision would be made.
The other thing I wanted to add on to that is, I think somebody had asked an earlier question whether vitamins were covered, and we had said it wasn't covered on the plan. So CMS does have exclusions to coverage under Medicare, and one of those categories is over-the-counter items that includes vitamins, mineral supplements, things like that. And CMS only covers medications that they deem as Part D, and there's specific requirements that a medication has to meet in order to qualify for that. One example of a medication that wouldn't qualify as a Part D medication is bulk powder. And so part of why CMS does want us to look at all the ingredients is to determine which ones qualify as Part D and which ones don't. And so we would need that specific authorization to look at the ingredients and then determine whether or not they're in line. The other thing with the special needs is, depending on what it is, we can be able to fold in some Medicaid coverage, but without knowing the specifics, I couldn't give you an exact answer. So it's not a very good place to leave the answer, but it's like, it depends, is the best that we can do. And that's because of all the regulations that are attached to compounded medications by both the federal and the state government.
Okay, thank you. There's a question in the chat about what is the cost for the monthly charge for Premier Plus. So can we answer that from the benefit perspective?
Yes, I can take that one. So the monthly premium amount for our Premier Plan Plus is $129.
Somebody had asked the question, how do you qualify for special needs? And I know there's a lot of processes involved in that. But would somebody like to give at least a high level answer in terms of how you qualify?
Yeah, I can take that one as well. So the highest level answer I can give is, if you are eligible and you have Medicare and Medicaid coverage, and you live in our counties, then you qualify to be on our special needs plan.
Thank you. And then in terms of starting the process to do any appeals, whether it's a tier, whether it's a medication, would our members go through our customer service line and then the processes start after that?
They would need their provider to submit a prior authorization request asking for that hearing exception. And part of what's in that request would be for the provider to state that all of the formulary alternatives, give reasons why all of the formulary alternatives on the lower tier would be inappropriate. So it would be a request that would come from your provider, because CMS does require the provider statement in terms of no other options are working on a lower tier level for you. So it would be the same as a prior authorization process.
Right. Thank you for that, Nanama. And I see, Wayne, you have your hand up. And I'll try to unmute you if I'm wondering if some of my colleagues might like to try to unmute Wayne if possible. Wayne has his hand up, but I don't see that his microphone is on.
Hello?
Yep, go ahead. We can hear you now.
There. Talk. So my dad came home from the emergency room. I forgot what he was on.
December 25th.
December 25th. Oh, he had a UTI. So they gave him an antibiotic, but he also had a prescription for a nausea medicine in case the antibiotic made him vomit. But it was December 26th when there was snow all over the road in Albany. So a friend thankfully drove his Suburban on the road and got our medication, but he came home with $100 nausea medicine my dad had a fit over. And he tried to appeal it, but they said he wasn't a cancer patient, so tough luck. And he was wondering how come in the past, when he came home from the ER with something else that was another problem, he didn't have to pay for it because we went and searched his records. Did something change from, I think it was 2018, when he had it before and didn't have to pay that much, to 21 whenever he had to pay over $100?
So I'm making an educated guess that the nausea medication may have been one called ondansetron. And this nausea medication has been FDA approved for certain conditions like chemotherapy. I will also turn it over to Nanama, who might have more information about that.
Thank you. So if the medication is ondansetron, there are certain CMS requirements around them. And the medication can be what is called B versus D. And so B is usually if somebody has a cancer diagnosis, and D is if it's not. The easiest way to answer this question is if it's anything less than a 3-day supply, CMS wants us to scrutinize it and see if it's for cancer or not. And if it's not for cancer, that the indication is what it's FDA approved to treat. And while it is common practice to use ondansetron for nausea based, whether it's because of an antibiotic that you are taking, CMS doesn't recognize that and doesn't pay for it. And so typically when providers write for ondansetron, hopefully they're writing for more than 3 days at a time so that CMS doesn't stop and scrutinize whether or not it needs to be used for the treatment of cancer. So that's the best answer I can give without having the specifics. And so if somebody needs to go to the provider, usually we're asking the providers to write for either 3 days, at least 3 days or more for the patient.
Well, it should have been 7 days because that's how long the antibiotic was for. I'd have to go find it, but it should have been, it was because the antibiotics were for 7 days. So he would have, the ER doctor would have written it out to have enough to cover that if he got sick.
Yeah, sometimes they do, sometimes they don't. And so if you want to submit it, the details of it, we can look into the specifics, but without having the information in front of us, I would hate to speak to something that wasn't accurate.
Oh, so even though this is last year, can we do something about it, or it's long gone because that was last December?
I believe since it's been over a year, we may be out of time frame, but still go ahead and submit it anyway, and let's take a look.
Okay, so who do we call to make sure we do it right?
Marika?
Yeah, so if you call customer service, we can go
Mhm.
ahead and take a look at that for you and get your information. Thank you, Danielle. So the numbers are listed in here. Our customer service line, our toll-free number. You can also submit a direct member reimbursement. I think the best way to handle this so that we can get you information would be to give us a call so we can look at the account specifically and see exactly what was going on and if it is in time frame and how we can help you out with that.
Okay, because everything should be in there since we'll have to look in 21 stuff and see where the appeal information is. Okay, well,
Yeah.
thank you, and he can work on that.
Well, thank you for all of these great questions today. I wanted to also give a personal thank you to Danielle, Nana Ama, Marika, and of course, all of our Samaritan Advantage members for joining us today. So please also watch your mail because a Safeway gift card, as I stated earlier, along with all the questions and answers that we discussed today, will be mailed to you within the next 4 weeks. And as always, your feedback to these lunch and learns that we're doing is always very much appreciated. And we always do a deep dive into those statements that you have made for feedback so we can help plan future sessions. So we're going to email an evaluation form along with the link to today's recording so you can also see these numbers that are right in front of you. And please take a moment to complete the brief survey that follows. And as a reminder, for all your benefit questions and concerns, we have very willing and capable live individuals in our customer service center that are ready and able and willing to take any questions or comments related to your health plan needs. So thank you again for joining us today, and we look forward to seeing you for our next Samaritan Advantage Lunch and Learn. Have a good day, everybody.
Thank you.
Thank you. Have a good day, everyone.
Thank you.
Thank you very much.